Children less than 6 months of age should use sunscreen sparingly on exposed skin, not necessarily because it's bad for them, but really kids less than 6 months and kids that are immobile should be put somewhere in the shade. So for example, if a child is less than 6 months and needs to be out in the sun, they should be covered with a hat, longer clothing, or under an umbrella. When buying sunscreen, look for types that have a sun protection factor or SPF of 15 or higher. Make sure that it's labeled as broad spectrum or specifically covers UVA and UVB rays. There's a new star rating system that is quite handy as well, but to be honest, I haven't seen very many of the sunscreens that have the star rating system on them. The more stars that there are, like 1 star is for less protection, and 4 stars is the maximum for sun protection that you can buy over the counter. For particularly sensitive areas, use the zinc oxide cream. That is the thick white or colored stuff that you see a lot of lifeguards wearing. It's really cool, but now there's a lot of clear zinc oxide options that are out there as well. Remember, sunscreen should be reapplied frequently, at least every 2 hours after being in the sun and immediately after being out of the water, even if it is waterproof sunscreen. When applying sunscreen, the spray is my personal favorite. My children are still pretty young and they're hard to keep in one place and corral for very long. So when it comes to the spray, we just spray it on your hands pretty good, rub them together, and then apply it gently to the forehead, cheeks, and ears and neck. And then the rest of their body you can kind of spray and just kind of rub down. With the lotions, making sure that you get a nice coverage and just making sure that it's applied evenly is important as well. The zinc oxide cream, don't be cruel. Just put it on the nose and around the ears, and thicker is better in those situations. If the sunburn causes blisters, fevers, chills, headaches, or a feeling of illness, it's best to be seen by your physician. These kinds of symptoms make us worry that something else like heat stroke is going on. More serious sunburns are treated just like regular burns and can get infected, so it's important to keep the wound clean and dry. Antibiotic cream, as directed by your doctor, is perfectly fine to apply as well. Well, those are some great tips on sun safety and protection. If you guys have any questions at any time, feel free to call your physician or us at any time.